I'm joined by Dr. Ed Kuffner with Johnson & Johnson Consumer Health and his wonderful daughter, Margaret, who chronicled her dad's, wow, talk about an experience in New York City. Ed, you left your day job to go to the front lines in the midst of a pandemic. What was that like?
Well, it was tough. It was chaos when actually I got up there. I hadn't been practicing in the emergency department for about 14 years, so there was definitely a little trepidation on my part. And then going into a pandemic, it was something like I never experienced before. There are patients everywhere. Rooms that would hold one patient were holding three. There were patients all over the hallways. And as soon as I got in there, alarms are going off all over the place. And you can just tell that this is different. In the end, for weeks, it was busier by 10 times than the busiest shift I had experienced ever working in the emergency department. The staff were amazing, trying to do the best job they could, but the entire healthcare system was completely overwhelmed.
What sticks with you when you look back on that time?
It was so hard on the patients and their families. The families weren't allowed and loved ones weren't allowed into the emergency department. They weren't allowed into the hospital. And that was really isolating for people. And so we actually spent a lot of time trying to, be the family for the patients while they were in the emergency department. And whether it was doctors, nurses, the techs, everybody really went out of their way to wrap our arms around those patients because we knew that they didn't have anyone else there.
Margaret, were you scared for your dad?
It definitely was scary because I was just hearing stories on the news and about how bad it was getting, especially in New York. So it was really scary thinking my dad was there. And also just when I would tell people, they'd be like, wow, that's really intense. And it was kind of hard, but I knew that he was there trying to help other people. So that's what made it okay for me.
Given what you saw and experienced, and what we sometimes see in the media of doubters, and this has all been blown out of proportion, what would you say to people given what you experienced?
I would never want to have to go into a situation like that again, where the healthcare system is overwhelmed. And it's heartbreaking to me to watch other areas of the United States and other areas around the world, those healthcare providers suffer what New York health system suffered. So what I would say to people is, you need to socially distance. You need to wear your masks. You need to practice good hygiene measures. And for all of us in healthcare, we need to be the leaders who are out there within our communities, within our families, promoting the importance of all of these measures.
Dr. Ed Kuffner, his daughter Margaret, thank you both for being with us and sharing this story that is so inspiring. Thank you, Dr. Kuffner, for what you did to help patients in need. And Margaret, thank you for chronicling it so we can share in the emotion and say thank you.
Thank you so much.
Thank you.